Why don't you tell me what you see as the key moral and ethical issues in healthcare?
Uh, well, there are a ton of them. I'll tell you the ones that are most striking to me because I tend to work in the hospital, and those the end-of-life issues are extraordinarily profound. It's one of the things that makes medicine so endlessly interesting. When I come out and do my clinical work, within 5 minutes, invariably, we're confronting an issue where a patient and a family are grappling with how hard to push at the end of life and trying to weigh the value of days or months remaining, how likely it is that some new chemotherapy or technology that we have might work. And sitting underneath that discussion generally is the cost issue, which is Medicare is slated to go bankrupt in 8 years, partly because we're not very good at saying no. Those issues are extraordinarily interesting and profound. They are part of what reminds me about what's so unbelievably gratifying and challenging about being a doctor. There's a lot of stuff we've talked about that really is pretty algorithmic, and I can imagine a computer doing it well and maybe even better than I can. These discussions of really grappling with patients and families trying to work through what do I do in a catastrophic situation where there's a knowledge imbalance. I know a lot more about it than they do, and yet we as a society have decided appropriately that they're in charge, that autonomy of the patient wins, and there's a context of people hoping against hope that something might work, but the chances of it working are very low, and then there's this price tag in the background. That to me is the dominant issue that we're facing in healthcare as it comes to ethics.